Ladies and gentlemen, good morning. This is a commencement fire and life safety announcement. May I have your attention, please? In accordance with New York City Fire Code, exit doors are located throughout the event area. Please take a moment, look around your seats, and find the nearest exit closest to you. In the event of a fire or emergency, please listen for further instructions from university officials and/or the podium. Thank you.
Please be seated. Good morning, and welcome to the College of Dental Medicine's celebration of the incredible graduating class of 2013. Our college was founded in 1916, admitted its first 2 students in the fall of 1917, and held its first commencement exercise in 1922. We are therefore here celebrating the 91st such exercise, and in just 3 short years, we will be celebrating the centennial of the founding of the Columbia University College of Dental Medicine. There's an old African proverb that says, "It takes a village to raise a child." Apropos to that, we must take a moment to recognize those in the audience or elsewhere who have supported you, our newest alumni, throughout the journey. They have supported you with love, understanding, emotion, finances, and have done so often at great personal sacrifice. It has been parents, grandparents, siblings, spouses, children, relatives, friends, and of course, classmates, who have been so supportive in your lives over these past 4 years. So let's give them a round of applause. I would also like to recognize our dedicated faculty. These individuals are true innovators in education, patient care, research, and discovery. The faculty has guided these young professionals over the course of their time here, becoming mentors, confidants, and colleagues. Colleagues they will remember throughout their entire career. In fact, many of the professional decisions that the class of 2013 will make will be based on these enduring relationships. This dedicated faculty is behind me on the platform, listed in the program, and in the audience. Please join me in acknowledging their devotion and contributions. I would like to introduce Dr. Julnell Davis. Dr. Davis, the Columbia University chaplain and the director of the Earl Hall Center, where she oversees the Office of University Chaplains, Community Impact, and the United Campus Ministries. Dr. Davis holds the honorary title of chaplain to the College of Dental Medicine, and it is my distinct pleasure to introduce her for the invocation.
Congratulations, 2013 graduates. Doctors, you are now critical members of healthcare teams for children, women and men, the young and the aging. Dentists, oral surgeons, and advanced specialists, you may be the first healthcare professionals to see the symptoms of systemic and debilitating diseases like osteoporosis, diabetes, HIV, heart disease, even cancer. You will be advocates for the quality of life, well-being, and dignity of your patients. You will be essential voices for public health, justice, access, and equity in dentistry and oral health care. May each of you have the courage and the humility to be wise, compassionate, and humane doctors. May it be so. May it be so.
The class of 2013 will always be a special class for me. You may not remember, but 4 years ago, at your white coat ceremony, your guest speaker was me. Yes, I had the distinct pleasure of welcoming you to our profession. How ironic that I will have the additional pleasure in sending you off as colleagues and alumni. You and I are both trailblazers, you in tackling the brand new curriculum, and I as a designer of such, and now your interim dean. I told you at that ceremony not to wish your 4 years away. I can honestly say the awards you have received, the global and community initiatives you have participated in, and your obtainment of the most desirable residency programs in the country, you did not wish the time away, but actively engaged us all. Our profession holds a certain status within society, to which you now belong. It holds us to a higher standard of trust and affords us rights and responsibilities to which the public expects no less than the highest ethical and moral commitments. During these past 4 years, the new curriculum has placed added emphasis on primary health, interprofessional education, and interprofessional care. This focus has led me to believe that the trust instilled by society in the dental profession warrants more. Since ancient times, the oath of Hippocrates has been required by many medical students at the time of their graduation in the United States and Europe. However, it was intended to be for all healthcare providers. And in 1964, Dr. Louis Lasagna, Dean of the Sackler School of Biomedical Sciences, Tufts University School of Medicine, and a 1947 graduate of Columbia University's P&S, wrote a modern version and suggested that it might be appropriate for all health professions to take such a similar oath. To the best of my knowledge, graduating dental students have not been required, although some schools have adopted this practice, to take an oath at graduation regarding the ethics of their practice or their place in society. Following through with Dr. Lasagna's suggestion, his version, somewhat modified, might be appropriate for the newly graduating oral health care provider, an activity I suggest that CDM adopt now. To that end, class of 2013, please rise. I swear to fulfill, to the best of my ability and judgment, this covenant. I will remember that first and foremost, I do not treat a sign, symptom, or disease, but a human being. May I never see in the patient anything but a fellow creature in pain or in need of my care. I will prevent disease whenever I can, for prevention is preferable to cure. I will apply all measures of truth and fairness as required to restore the oral health of my patients, my community, and those without access to care to the best of my ability. I will remember that there is art to oral medicine as well as science, and that sympathy and understanding are an integral part of treatment. I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for patients' recovery. I will respect the hard-won scientific gains of those in whose steps I walk, and I gladly share such knowledge as is mine with those who are to follow. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. I will remember that I remain a member of society with special obligations to provide care to all of my fellow human beings. Here I am, ready for my vocation, and now I turn to my calling. If I do not violate this oath, may I enjoy life and art, be respected while I live, and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. If you affirm, please say aye. Please be seated and welcome to the profession. It now gives me great pleasure to introduce Dr. Lee Goldman to bring greetings from Columbia University and our medical center. Dr. Goldman is the Harold and Margaret Hatch Professor of Medicine in the College of Physicians and Surgeons, Professor of Epidemiology in the Mailman School of Public Health, Executive Vice President for the Health and Biomedical Sciences, and the Dean of the Faculties of the Health Sciences and Medicine. Dr. Goldman.
Well, Dean Myers, Dr. Lamster, distinguished faculty, class of 2013, families and friends. I apologize that despite all those titles, I don't have a dental title. But as some of you may know, my grandfather was a dentist. Now, he was a dentist in a very different era. He never went to college because back in his day, didn't have to go to college to go to dental school. Not only that, he loved to tell me how he never actually graduated from high school. He was apparently thrown out of school for not passing some course and ended up getting his high school equivalency certificate. I think he was a good dentist. He took out several of my wisdom teeth. He didn't straighten the tooth in front, but he otherwise, I think, was a very capable dentist. But that was a different era and a different model. Here at Columbia University Medical Center, the dental school, the medical school, the nursing school, and the School of Public Health all share a campus, all share ideals, all share a commitment not only to learning the practice of their profession, but also to mastering the science that underlies that profession. So here, as you know, your children and loved ones who are graduating not only graduated from high school, not only graduated from college, but have had a curriculum revised and redesigned over the past several years that guarantees that they're absolutely at the forefront, not only of the modern techniques of dentistry, but also all the science that underlies that. Nevertheless, I'd be lying to the graduates if I said, you know everything now. Don't worry about the next 30 or 40 years. We taught you everything. We may have done our best to teach you everything that's known and that's important today. But over the course of your career, the profession will change, and we collectively have hopefully prepared you well for the lifelong learning that will be required for you to be at the top of your profession throughout your careers, just as we know that you're at the top of your profession today. So on behalf of everyone at Columbia and Columbia University Medical Center, I want to congratulate you on a job well done, congratulate you on being at the absolute top of your games, and warn you that there's still a lot more learning to go on, but to recognize that you couldn't be better prepared to be leaders in your profession, to make us, your families, and yourself proud throughout the remainder of your careers. Congratulations.
Thank you, Dean Goldman. Our Alumni Association is one of the great strengths of the College of Dental Medicine. You are now all members. And the current president of the Alumni Association is Dr. Renee Litvak. Renee earned her bachelor's degree from the University of Pennsylvania, her dental degree from Columbia in 2002, and her postgraduate training certificate in endodontics from Columbia in 2004. Renee is the first alumni president to graduate after the year 2000, and in this role, she has brought great energy, dedication, vision, and enthusiasm. It is my great pleasure to introduce Dr. Renee Litvak. But before Renee speaks, I would like to present Renee with a plaque. Renee is concluding her 2-year term as alumni president, and it is for this that we give her this recognition. Columbia University College of Dental Medicine, Association of Dental Alumni, in recognition of Dr. Renee Litvak, 02 Endo 04, for her outstanding service and dedication as alumni president, May 2011 to May 2013.
That is so sweet. Thank you very much. Good morning. It's an honor and a pleasure to have the opportunity to speak to all of you today on behalf of Columbia University's Dental Alumni Association. I want to congratulate the entire class of 2013 and your thrilled and supportive families. You represent the best and the brightest dental graduates in the United States, and your accomplishments should fill you with pride. I know firsthand that the past 4 years have not been easy. Late nights studying for exams, stuffing your brain with more tedious facts than you ever thought possible. Long hours in the preclinic, waxing up developmental lobes with just the perfect incline, and praying to the clinic gods that your patient who needs that fixed partial denture you have to complete for graduation follows through with the treatment plan in place. And not only have many of you worked tirelessly to complete the mandatory curriculum, but many have gone far beyond the requirements expected. You have participated in student government, traveled the world donating dental services to those in need, volunteered to assist and raise funds for research projects, and much, much more. As you leap to your next professional stepping stone, my wish is that you will keep the College of Dental Medicine close to your hearts. The faculty and administration at the dental school have imparted in you a firm value system with ethical tenets that will remain a core foundation for the duration of your careers. The goal of becoming competent, confident, and compassionate clinicians has been attained. To the class of 2013, we, the alumni, are your advocates and your colleagues. Your affiliation with the College of Dental Medicine is only just beginning. Use our Alumni Association as a resource. We will serve as a bridge between the college and your professional endeavors. We hope that we have fostered a sense of loyalty to the Columbia family and can count on your future participation. Keep in touch. Attend our alumni events and CE courses. Volunteer, mentor, and teach. Give back to the institution that prepared you well for a promising professional career. Good luck to all of you. The future is exciting.
I think our next speaker is the one you've all been waiting for. So our next speaker is Dr. Austin Carr, President of the Class of 2013. I have come to know Austin for his dedication to his class, his tolerance, his focus, and his direct approaches to solving problems. The Class of 2013 truly could not have had a better advocate. Dr. Carr?
Good morning. It's great to see all this goodwill in the room right now. We have a lot of really happy students, a lot of really happy faculty, because they're finally getting rid of us. The class of 2013 is leaving. And who could blame them, really? Despite all the pleasantries of this week, to our guests, I'd like to let you in on a little secret. This saintly, picturesque group in front of you developed quite a reputation during our time here. Yes, our bickering with each other, thank you very much, and our complaining or providing quality feedback, as we prefer, became a thing of legend. So much so that we were assigned the less than desirable superlative of the worst class ever. That's true, that happened. Someone up here said that. So the worst is really something memorable for sure, but yikes. This is strange because on the surface and on a personal level, we have some amazing and desirable attributes in our ranks. The always upbeat attitude of Maria, the incredible artistic talents of Hyungju, the chiseled physique of Matt Kozin. But even those weren't enough to save us. So how do we send off the worst of all time? And what does that make me up here? Well, I thought it might be nice to poke fun at some of our less than shining moments along the way. But 4 years is a long time. Fortunately, for all of our class's faults, there is one area in which we excel, and that is sending emails. Yes, nearly 6,700 emails proudly display the CDM badge in my Gmail. They range from the serious, health problems, lost appendices, which we had an inordinate number, to the incredibly unserious, which was essentially anything sent from Edwin, including last night. Jordan is still the greatest. So as I look through this rich G history, I was really surprised at the lack of material. Maybe I was hypnotized by all the chair-available subject lines, but I did not find the type of conflict that our reputation would suggest. You see, as highlighted repeatedly today and yesterday, we were the first class in an untested curriculum. Trailblazers or guinea pigs, depending on who you ask. And with that came a very special request at the beginning of our time here. We want your feedback, and feedback we gave. I'm certainly not up here to bash the school. I really, really enjoyed my time here, and I think most of us did. And of course, we might have been a little too loud with our complaints, and of course, we might have had some unrealistic expectations. But maybe it was a little on the school. Maybe some parts of the curriculum didn't work as well in practice as they did on paper. Thankfully, most did, but some parts didn't. But one of the strongest assets of this school is its willingness to listen to its students. Essentially, all the office doors are open, and there are plenty of avenues to air an opinion or provide a suggestion. In fact, in many instances, our opinion was actively sought out. Though not every suggestion we made translated to change, a lot did. And rarely did these changes happen for us. That was deployed later, after the fact. So maybe we were very vocal and complained a lot, and of course that was unpleasant to hear at times. But maybe our vocal nature and your willingness to listen made the school a better place for subsequent classes. Earlier this week, Scott, who gave a very nice talk yesterday, we compared notes to ensure that our speeches wouldn't overlap too much. And I find it pretty telling that our themes were essentially the same, even though we went about them in different ways. And that was, we hoped that we, as a class, however slightly, left this place better than we found it. So that's my final defense of the class of 2013. I hope I've represented you all well, and hopefully we will have crept up in your minds from the worst ever to, not so bad. So in my closing time, I'm gonna go a little sentimental. I remember back during my college days, I heard a lot of, these are the best years of your life. You really have to live it up. And that notion never sat very well with me because college ends at 22. There's a lot of life to be lived after that. I certainly hope that isn't the peak. I hoped and hope that the next stage in life is always better than the previous. And it may not always end up that way, but for this stage, it's been absolutely true. These have been the best for me. And I hope the next stage is better, but that's tomorrow's concern. So for today, I'm gonna cherish these last 4. And even though I haven't done dentistry in what seems like months, this still feels like a very abrupt ending. We've all been through enough graduations and schoolings to know that this is really it. Despite the best intentions of keeping up, we won't. So I'm gonna take my last seconds with you here to say thank you. Thank you for being a part of this stage, and thanks for making it fun. I wish you all the very best.
Our commencement speaker today is no stranger to the current CDM community, Dr. Ira B. Lamster. Dr. Lamster received his DDS from the State University of New York at Stony Brook, his master's in medical science and certificate in periodontology from the Harvard School of Dental Medicine. He served as Dean of the Columbia University College of Dental Medicine from 2001 to 2012, and is currently Professor of Health Policy and Management in the Mailman School of Public Health. Ira's research efforts have focused on diagnostic testing and risk assessment for periodontal disease, the interrelationship of periodontal disease and systemic disease, the oral health of older adults, and the future of dental education and practice. Dr. Lamster is the author of more than 150 manuscripts and book chapters. He is the editor of the 2008 book, Improving Oral Health for the Elderly, and the editor of a 2011 volume of the Dental Clinics of North America. I personally have said in many venues how much Ira has personally meant to me and the growth of the College of Dental Medicine. And so it gives me great pleasure to welcome the class of 2013's choice for commencement speaker, Dr. Ira B. Lamster, Dean Emeritus of the College of Dental Medicine.
Well, it really is very nice to be back. Dr. Goldman, Dr. Myers, distinguished faculty, guests, and of course the graduates of CDM Class of 2013. Good morning. First, allow me to add my congratulations to all who have sent their best wishes to the CDM Class of 2013. When I welcomed you here nearly 4 years ago, I told you that you were pioneers, since we were about to introduce a major revision to our curriculum. It's not easy being in the pioneer class, but you managed that well. Never passive, and that really just summarizes your Your remarks, Austin, never passive. You gave us valuable input into the new curriculum, and we listened to your suggestions to improve our predoctoral program. Allow me also to thank you for the honor of being chosen as the commencement speaker. This honor means a great deal to me and is much appreciated. I have attended quite a few graduation ceremonies, including the last 11 as Dean of the College of Dental Medicine. These experiences have helped me prepare for this honor. First, I recognize that I stand between you and the awarding of your degrees. Please know that I am sensitive to that reality. Second, having attended many graduation ceremonies and listening to many commencement speakers, there are two key principles that all graduation speakers should consider. First, do not try to be too profound. Many have tried and very few have succeeded. Second, be brief. Content is important, but so is brevity. Now to my message. I decided to review some lessons I have learned as dean. These are really life lessons that apply to us all as we interact with those around us. And I do hope that some of these points will resonate with you. So here are 7 thoughts. First, strive for a full and balanced life. That is, having both a successful professional career and a satisfying personal or family life. In today's changing world, achieving success in one's career is an enormous challenge. But there's a trade-off in terms of what price you pay for professional success. And here I see a difference between the generations. Of my generation, we baby boomers often gave preference to the professional side, and our private lives, time with family and children, suffered. There is more balance in your generation, the millennial generation. Time not spent with young children is not recoverable, so think about your choices. Number 2, actively seek contentment. I know this is easy to say and difficult to achieve, but you do have control. If your situation is not right, be proactive and change. Regardless of your age, it is easier to change now than later. Number 3, demonstrate commitment. Be passionate about your practice, your research, or your teaching, and bring that same attitude to your community activities and to your spiritual life. Believe in your cause, your job, really all of your endeavors. A sense of commitment will project to those around you, and real enthusiasm is truly infectious. Without that passion, you cannot lead effectively. Number 4, when someone does well or accomplishes something of importance, tell them so. You can acknowledge their accomplishments publicly or privately, whichever is more appropriate. That thoughtfulness will be appreciated and says that you value the accomplishments of others. Number 5, react to situations in a thoughtful manner. If someone comes to you with an idea or a request, it is often best to withhold an immediate response. Take some time to think about your answer, and you may see things more clearly in a day or so. Be sure to respond in a timely way, and remember that your answer can be yes, no, or suggest an alternate approach. Now my last 2 points, which are particularly important to me. Number 6 is mentorship, or professional altruism. And that is a necessary and essential part of a professional's life. There is no greater success than the accomplishments of those you have mentored. It truly is better to give than to receive. This legacy will grow as you watch those that you have mentored become mentors for others. And number 7, and my last point, I believe that you may advance in your profession by managing up, and that is working with those that you report to. However, you will be judged as a person by how you manage down or how you work with the people who report to you. Consider what life lessons you have learned in the past 4 years. It's always good to take stock at transition points in your life. That reckoning will help you mature as a person and as a professional. This educational experience has changed you, and you leave with special knowledge and special skills. The faculty have prepared you well for your career. We know that those who are closest to you, your parents, grandparents, siblings, spouses, children, and friends have helped prepare you for personal growth, and they share this special day and your success with you. In the May 20th issue of Time magazine, Joel Stein wrote a cover story about the millennial generation. He concluded that as a group, you are earnest and optimistic, can be characterized as pragmatic idealists who want new experiences which are more important than material goals. He also described you as cool and reserved, and concluded that your generation could be a great force for positive change. You challenge convention and find better ways of doing things. Knowing you individually and collectively, that is a good description of the CDM class of 2013 and foretells great things for our profession. In closing, thank you again for this honor, and my best wishes to you and to your family on this very special day. Thank you.
Each year, we present one faculty award at commencement, and Dr. Letty Moss-Salentine, Vice Dean for Academic Affairs, will present the Edward V. Zigarelli Teaching Award.
Dean Goldman, Interim Dean Myers, colleagues, new colleagues, families and friends. I wish to add my congratulations to all of you on this very important day. You, our new colleagues, have worked hard, and today you will hold that document that tells you and the world that you have succeeded. And I know I'm standing between you and that moment, so I will make it really brief. You have journeyed together for 4 years, and you have forged friendships, many of whom will last for your lifetimes. I am grateful to have participated with you in part of that journey. You are a group of hardy individuals, and we have already mentioned several times that you are trailblazers of our new curriculum. I wish you the very best in your careers. You really deserve it. Now, it is customary during this ceremony to honor a member of the faculty for excellence in teaching. The Zigarelli Award is named after the late Dr. Edward Zigarelli, a former dean of the College of Dental Medicine. This coveted award is given to a member of the faculty who, in the opinion of a selection committee of faculty, students, and alumni, has distinguished him or herself as a teacher. The recipient of this year's Zigarelli Award for Excellence in Teaching is Dr. Angela Yoon. Angela was admitted to the College of Dental Medicine, or as it was then called, the School of Dental and Oral Surgery, in 1999, after earning a BA and 2 master's degrees at Boston University. She earned her DDS degree in 2003 and became the first resident in a newly established residency program in oral and maxillofacial pathology. In 2006, Dr. Yoon joined the dental faculty. She was board certified in the same year and is now in charge of that residency program from which she graduated. Angela is a beloved teacher, an excellent mentor of student research projects. Most importantly, she has not forgotten what it is like to be a student. It is with the greatest pleasure that I will present this important award to Dr. Yoon.
So yes, as Dr. Salentine, congratulations, Angela, wherever she went. As Dr. Salentine said, she was between you and why we all came here today. So now we have the presentation of diplomas. Note that yesterday we had our annual class day when individual awards were presented. These are noted in the program, and we congratulate those students who were so honored. Joining me to present the diplomas will be Vice Dean Dr. Letty Moss Salentine, Associate Dean for Student Affairs and Admissions Dr. Laureen Zubiari, Director of the Fourth Year Clinical Program Dr. Vicky Evangelidis, and Dr. Richard Lichtenthal, Chair of the Section of Adult Dentistry. Please come forward. Family members who are participating as hooders should follow their student up the ramp when their names are called. Hood them and go back down the same ramp to their seats. Please take photos from the right side aisle only, my left, your right, when your graduate is on the stage so as not to block the middle aisle that is recording the ceremony and projecting on the large overhead screen. Dr. Lichtenthal.
Ready to go.
Are we ready?
Are we ready? You've been ready for a long time. First row, please stand. Dr. Adela Abisagun. Dr. Abisagun will be hooded by her father, Dr. Akiwunmi Abisagun. Dr. Abisagun. Dr. Garrick Alex. Dr. Alex will be hooded by his father, Gary Alex. Dr. Gary Alex. Dr. Sophia Arafin. Dr. Mohammed A. Arif. Dr. Arif will be hooded by his mother, Dr. Anwar Nasser. Dr. Ashley Azizian. Dr. Azizian will be hooded by her mother, Dr. Karina Arapetian. Dr. Michael Thomas Barnes. Dr. Graham A. Beerville-Trance. Dr. Beerville-Trance will be hooded by his father, Dr. Howard Trance. Dr. Rebecca Lynn Katz-Block. Dr. Katz-Block will be hooded by her father, Dr. David Katz, CDM class of 1982. Congratulations. Dr. Maria Brakowitz. Dr. Brakowitz will be hooded by her sister, Dr. Elizabeth Jane Brakowitz. Look alike, don't they? Kiss, kiss. Dr. Chelsea Brockway. Dr. Scott A. Bryant. Thanks, Scott. Dr. Jennifer Perez Caroline. Come here, you little. Dr. Austin R. Carr. Dr. Carr will be hooded by his father, Dr. Wiley Carr. What is it? Dr. Jerry Chu. Jerry. Dr. Hankyu Cho. Dr. Jun Seok Cho. Dr. Cho will be hooded by his brother, Dr. Young Seok Cho, CDM class of 10 and Perio program this year, 2013. Shinso. Dr. Shenjudi Chowdhury. Dr. Eileen Y. Chun. Where's the family? Should have brought her family. Congratulations. Dr. Matthew J. Kozin. Dr. Stephen C. Dedayan. Dr. Dedayan will be hooded by his father, Dr. Gary Dedayan, who is a member of the CDM faculty. Dr. Vruti M. Dave. Dr. Dave will be hooded by her fiance, Dr. Mehul Shukla, who is a radiology resident at Harlem Hospital. Did I get it right? Dr. Timothy J. Dawes. Dr. Dawes will be hooded by his father, Jeffrey Dawes. Yeah, well, too late. Dr. Hung Hoa T. Do. Dr. Shlomo T. Eisenberg. Dr. Eisenberg will be hooded by his father, Dr. Stephen Eisenberg. Dr. Ricky Michelle Steele Esterson. Dr. Esterson will be hooded by her father, Dr. Edward Steele. Hey, Rick. Dr. Michelle A. Feintuck. Dr. Feintuck will be hooded by her father, Dr. Stuart Feintuck, CDM class of '76.
Good to see you.
Stuart. Hey, baby. Dr. Jiafeng Gu. Congratulations, Jiafeng. Still going to be an orthodontist? Okay, just checking. Dr. Tenor Huang. T for trouble. Dr. Nathaniel E. Jacob. Did they get your new bag? Dr. Wan-Wu Zhang. Dr. Matthew T. Jensen. Dr. Jensen will be hooded by his father, Dr. Kurt Jensen. Good man, Matthew. Yeah. Dr. Ramya Shyamala Kanakalu. Dr. Gregory Cass. Dr. Cass will be hooded by his father, Dr. Fred Cass. No, it's all right. It's not like he has to wear it to work. Dr. Julia Ratner Cass. Dr. Ratner Cass will be hooded by her father, Dr. Ben Ratner. Okay, Ratner Cass. Dr. Jeremy Katz. Dr. David A. Kellogg. David. She's laughing already. Dr. Helen Kim. Yeah, I know. Don't forget that. Dr. Hyungju True Kim. Dr. Karen L. Kleiman. Okay, baby. Dr. Rebecca H. Konigsberg. Dr. Konigsberg is going to be hooded by her father, Dr. Andrew Konigsberg, CDM class of 1980. Where was I? Dr. Julia Koo. Dr. Evan S. Kraus. Dr. Kraus will be hooded by his father, Dr. Alan Kraus. Ooh, oh. Congratulations. Dr. Ming Chun Lai. So Congratulations, man. Pay attention. Dr. Jessica S. Lee. Dr. Lee will be hooded by her father, Dr. Sung-gun Lee. Dr. Mee's son, Michelle Lee. Congratulations, Suya. Dr. Soo-Yun Lee. Congratulations. Dr. Theodore Tak Lee. Congratulations. Dr. Matthew C. Lopresti. Dr. Lopresti will be hooded by his father, Anthony Lopresti, Dr. Anthony Lopresti, CDM class of '80, a member of our faculty. Tony, baby. Dr. Camille E. Marquis. No. Come here. Get one. Dr. Prakhar Mehrotra. Dr. Mehrotra will be hooded by his father, Dr. Nikhil Mehrotra. Dr. David Moisa. Dr. Moisa will be hooded by his mother, Dr. Robin Moisa. Dr. Jonathan M. Moskowitz. Jonathan. Dr. Jeffrey Eng. Dr. Young C. Okeke. Dr. Okeke will be hooded by his sister, Dr. Nancy Okeke, CDM class of 2010. Young hurt his foot chasing after a completion slip today. Congratulations, Young. Help him, help him. Dr. Darshan K. Panchal. Now we're going to hear it. Dr. Benjamin Jonas Pass. Dr. Erica Merrill Phillips Caffrey. Don't forget the jewelry. Dr. Victoria Ra. Congratulations, Victoria. Dr. Lovina Rastogi. Congratulations. Thank you very much. Dr. Gregory Rosenberg. Great. Dr. Hoon Sagang. Dr. Sagang will be hooded by his wife, Gloria Herr, CDM class of 2012. Give her another kiss. Go ahead. Give her another. Dr. Edwin Smith. Dr. Smith will be hooded by his father, Dr. Pierre Michel Smith. Congratulations, kiddo. Dr. Sophia Smith. Congratulations. Dr. Rachel Snyder and friend. He has to shake everybody's hand.
Thank you.
Yes. Congratulations. Sign him up. Get his name on a contract. Yeah. Dr. Jia Yan Sun. Dr. Sun will be hooded by her father, Dr. Won-Oh Sun. Dr. Justin D. Steinberg. Justin. Dr. Jonathan Martin Stephens. Dr. Stephens will be hooded by his father, Dr. Willie Stephens. Yep. Congratulations, yeah. Dr. Christopher M. Stewart. Dr. Ilana M. Stullo. Dr. Jenny Yi-Ji Sun. Looking good, looking good. Yeah, all right. Dr. Marcus R. Sir. Dr. Shakil Syed. Dr. Syed will be hooded by his brother, Dr. Aman Syed, CDM class of '99. Good to see you. Shaquille, good to see you here. Dr. Stephen J. Tangretti. Dr. Tangretti will be hooded by his father, Dr. Salvatore Tangretti. What? 77? That's right, you are. Dr. Tangretti graduated CDM in 1977 and Stephen's grandfather graduated in 1924. Dr. Christina Allison T. Girls, aren't they sitting nice and quiet? They're sitting so nice and quiet. They look very good. So well behaved. Dr. Evan T. Tran. Dr. Sharon E. Wiesel Thiel, and friend. Hey. Hi. She wants to get out of here. Dr. Robert Yan. Should I even announce his name? Yang. Michael Yang is not here, should I announce his name? And our best wishes to Dr. Michael Yang, who's not here. He's thought it was better to get married and to come and get his grad. But everybody has a choice in life. Thank you. Dr. Myers?
So, before we depart, I would like to express my personal congratulations to the class of 2013. My class, start to finish. Thank you all for being with us for this graduation ceremony and for your support of the class of 2013. Please join us for a reception immediately following in the outer oval. I ask if you would please remain in your seats until the processional has left the immediate area. First the faculty, and then our newest, brightest, and greatest alumni. Be well, do good work, and always remain part of Columbia. Good afternoon.